Mayor O'Neill, Mayor Pro Tem, Consul, thank you very much for inviting us to join you today. I'm Henry Rice. I'm a surgeon at Duke University, and I am honored to be speaking with my colleagues, Asmund Johnson, Lorraine Graves, and Christopher Solomon on our project called Prescriptions for Repair. And in following Councilwoman Caballero's comment on creative ways to tackle tough problems in Durham, that's what we did. Our program was designed to address part of the challenges, the complexities of the epidemic of gun violence in our community. I remember standing here a year ago with our team asking you for partial support, and I want to thank you for it. And with your generous support and with support of Duke Health, we're able to operate this pilot program for 1 year. We started it, we ended it on time, we came in under budget, and it's our pleasure today to share with you some of the lessons that we've learned to help inform steps moving forward. That being said, first thing I want to emphasize is that this program was really a team effort among community groups, Restorative Justice Durham primarily, Duke University, NCCU, and the city. And these are groups that don't often work together to address some complexities that our community faces. I want to thank Councilwoman Holsley for introducing us to the social work staff at NCCU, and we were able to really leverage all the expertise that, that each of us brought to the platform, and we're here to share it with you. So I'm going to yield to Ms. Johnson.
Thank you so much, Council, and everyone listening. I was the coordinator for the program, so I've had the great privilege and honor to be the hub in the middle of the wheel, pulling together so many different interests, motivation, expertise, and to be able to communicate that clearly and using our goal. The goal of our pilot was very simple, and it was to listen and learn what survivors of gun violence need to heal. We did that through the structure that you see there on your screen, which was through listening sessions. We had community-based trained volunteers. Well, they were paid, I apologize, that came together, 2 facilitators and a survivor in a room, a private space in the city, mostly libraries, to be able to just listen to the story, ask the restorative justice questions. What happened? What were you thinking and feeling then and now? Who was affected and how? And what needs to be done to make things as right as possible? That's what our sessions were. Survivors received up to 8 hours that they were allotted to be able to share their story in a non-judgmental way through the restorative justice approach, receive compensation, as did everyone involved with our pilot, create an individual prescription for repair. We did our transcription process, and then we'll be doing our dissemination process starting with these presentations, but there will be a public report to follow. How do I get to the next one? Sorry, I'm not so tech savvy. So these are just a few of our milestones. So our pilot ran from August through October because we are still facilitating. We still have about 5 participants who are still finishing up their sessions. We've had 28 participants to date. 11 were survivors, meaning that they were shot. And then we also had 17 loved ones who came in support of their loved one who was murdered to be able to share their story. We did train 28 community-based facilitators. I always say thank you, Councilmember Javiera, for coming to our training and also for your advocacy, and everyone for your collaboration and participation with Prescriptions for Repair. We did conduct 79 sessions, which is 158 hours of listening. And then we had our monitoring and evaluation process that was done separately through the Duke Institute for Health Innovation, where we also did exit surveys for both facilitators and survivors to be able to reflect back on our program. And then we did our qualitative analysis of the lessons learned, and I'll now pass it off.
Good afternoon. So we're going to give you some information regarding the outcomes that we received. And one of the things that we learned when we conducted the sessions was that we really did enjoy listening to the stories that were told, and that it was a gap in care And so we wanted to make sure that part of this information that we're sharing, that it was very valuable for us to hear, and that we also had a participant to say, I feel like there are parts of myself that I've taken back because of these sessions. So it was very powerful for the individuals to respond.
And another key theme that came out of the listening sessions were poverty, race, and racism. And so the survivors talked a lot about their personal experiences with gun violence and how poverty and structural racism, how they perceive that being contributing factors to gun violence in their community. They talked about the harm that gun violence does in their community, and some examples of that were the breakdown of social networks, relationships, the breakdown, the expectations of some of the social norms, in addition to, again, talking about the economic challenges to control gun violence in their community. One of the participants stated with gun violence, it's happening to people in poverty. Somebody is giving them the guns and selling them. So again, the feedback that we received really helped us to see how survivors were feeling and thinking as it relates to experiencing gun violence in their community.
Thank you. A couple of more key lessons that we've learned from survivors of gun violence is respondent after respondent after respondent emphasized that there's a need to focus our resources on our children and our youth before people get caught up in a cycle of gun violence. There were some very constructive sort of recommendations, such as the need to build our stock of community youth centers, other school-based resources, as well as to engage with local leadership and knowledge so that these resources are modeling opportunities that are accepted, that are culturally relevant, and this was really thought by almost all the participants in the project. So I think we really do need to listen to those most affected by gun violence when it comes to thinking about resource allocation. Here's just one quote of this, is that kids need to have something when they get off that bus, when they walk home from school, that they can look forward to go to, and somewhere that they can learn and do. And finally, one of the fourth big lessons that we learned is that when you think about novel projects like this to address the challenges of gun violence, to sustain it beyond a pilot project really does take new thinking among public, private, and community partners. And how do we do this? We learned a tremendous number of lessons how to do this in the context of gun violence. We've built bridges between experts at NCCU, Duke, and the city. We've learned sort of just practical things, how to get Uber accounts to get people things, how to arrange research agreements. Where to go next really kind of comes down to how do we take these lessons and implement them in a way that is sustained. I will say that one of the real concrete examples from many participants is a need for community navigators, people to help survivors of gun violence, both in a physical space as well as in a support space, know where to get the resources they need during the trauma recovery period. Again and again, people felt lost, and then oftentimes our program was the first time that they were approached with access to some of these resources. This person said we need community advocates, literally meaning people who know the neighborhood, somebody who knows the names of the streets, the nicknames for the neighborhoods. They're the counselors, the psychotherapists, the social workers. That's the resource. So that is just a snapshot of the lessons learned. As Ms. Johnson mentioned, we actually have a small report for you. We have a larger report coming out to some of our community members. We actually have some academic publications, and we're continuing to work and learn from this, and we'll certainly keep you in the loop and hope to partner with you moving forward. Happy to take any questions or comments as well.
Thank you so much for a great presentation. Councilwoman Jose Hyman, we'll start with you first.
You know I have to make a comment. One of the things that I love is that when I had first got on council, I know that this was something that they were working on, and when you first presented, I felt like there was a social work lens missing. The fact that I didn't want people to be re-traumatized and not have someone who has been clinically trained to be able to address that. And so I immediately went into action to get you connected to my outstanding, did I say outstanding? Outstanding colleagues, Dr. Graves, Professor Solomon, because that's how we're trained. And we are actually educating the new generation of MSWs to be able to look at people look at things from a person and environment lens. You know, and so when you're talking about that, they are saying, which is not like surprising to me, that they are looking for people who are like care navigators, people who kind of know some of the things that are going on in their communities, and that stands to that person and environment, that ecological system that we teach our students and that how we are trained. And so I am so grateful that you took that feedback from me. For maybe the 6th time I felt like I really should have been on this council and brought a social work lens that no one else really had. And so I am so grateful that you were able to work together in collaboration. And I want to see that, you know, I know you're going to put your findings in writing, your outcomes, but I really want to move forward to how do we begin to really put the programs involved that these people that, the residents that you spoke with said they needed. We always do a lot of this, pilot stuff and so, but how do we then move forward? And so I'm hoping that the council continues to push the outcomes that you are going to put in your presentation, and we move forward on it, because clearly people who have been victims of gun violence need the help, they need the education, and they need the expertise. So thank you so much. Thank you for my colleagues that didn't kill me when I was like, I got something for y'all to do. I appreciate it. They have had a lot of that since I've been on council. So I thank you, I thank you, I thank you. Oh, you're back.
Any other comments? Councilwoman Caballero.
Just very briefly, thank you so much for all of your work. Really excited that that we were able to do the pilot, and look forward to figuring out what our next steps are. Thank you.
Again, we appreciate the collaboration with NCCU and Duke and the city. When we first started talking about this, I did have some reservations. What are we gonna uncover? And so I am pleased with your results and look forward to your final report, and hopefully we can move forward. Thank you so much. Go ahead, Mayor Pro Tem.
Thank you, ma'am. I'm sorry, I was raising my finger. So Dr. Rice, good to see you again, and thank you for bringing this brilliant team with you. And Councilmember Hyman, you're right. Thank you for what you brought to the expanding this. And I want to thank the members of the Community Safety Task Force as well, who brought this to us. I'm looking forward to reading the full report. I actually do read those things. I'm looking forward to reading the full report. I do want to say, we're the government, so we tend to focus on interdiction, getting the guns, making arrests, trying to focus on the front end. And we don't do nearly good enough a job with the afterwards to folk who have been victimized. We think prosecuting is serving them or making arrests. So it was really a pleasure and a privilege to be able to vote for this and support this on the back end. The pilot's over, but I would certainly be interested in looking for ways that the city can, and in a concrete, and thanks Duke for putting up some money as well. The city can continue to partner to serve victims after the fact, in addition to or above and beyond just getting guns off the street and the government front end stuff. So thank you for some really wonderful work. I can imagine what some of the things you heard from folk who were victimized, and we certainly pray and hope that this helped in their healing process and that some good was done with spending this money, and hope we look for more on-ramps to do more good in this way in the future. Thank you so much. Good to see you all. Thank you, Madam Mayor. I yield back.
Thank you. Thank you all. We now move to item 9,